Liposculpture is liposuction, but we do liposuction in a way, it's not just removing fat. Here you're sculpting the body to give this beautiful, delicious shape with curves. Beauty, in my opinion, is about curve. The more curves you have, the more beautiful you are. You can find a skinny woman, no curves, not interesting. You can find a big woman with a lot of curves, voluptuous. That makes it very beautiful, very interesting, and very sexy. So the skill of a liposuction doctor is not just to remove fat, it is to shape the body in a way that makes it look very beautiful, sexy, and very interesting to look at. When something is flat, it's boring for our eye as a human being. When something is curvature, there's a lot of intriguity in it, and that makes it much more interesting. Liposculpture is removing fat from certain areas more than other areas to give this beautiful curve, narrow waist, nice curve in the sides, nice curve in the back to give a beautiful sink above the butt area. And that's what we mean by liposuction. Sometimes after we've done the liposculpture and sculpted the body in this nice beautiful curvature shape, the fat is collected in a special way and processed in a special way while it's still alive. We add certain medications to the fat to prevent infections and to prevent rotting of the fat. Then we process the fat, we put the fat back, we redistribute the fat into certain areas of the body to enhance the curvature thing. A very common place where we transfer the fat back to is the buttocks. We transfer the fat sometimes into the hunch of the buttock to give you this beautiful nice curve, or to the hips to give this nice beautiful half a moon type shape. My goal is, imagine there is a basketball, you cut the basketball in half, and that's our purpose, to make the butt in that shape. Certain parts of the butt are more responsive to fat transfer than other parts of the butt, especially where people sit. That area, when there's too much pressure in that area, so there's a chance the fat may not take. So we recommend after the procedure to sit on a special donut that will help. There's a technique that will help, the fat stay, because many people say, is the fat going to stay? Is the fat not going to stay? If you follow the instructions, the fat will stay, at least in a big percentage of the fat. What are the special instructions you have to follow? First, the doctor role to make the fat stay is, before you put the fat, before I put the fat in the butt area, I prepare the butt area, the receiving area, I prepare it. How? I go inside with my cannula and I scratch the existing fat. This will stimulate the body healing abilities, because God created our body to want to heal itself. Once you scratch the existing fat, that's like an inch below the skin, okay, you don't feel anything, but your body will notice, oh, there's an injury in that area. The body healing abilities will start working. Then I add the fat to that area. The body will incorporate the whole thing as one and will heal the whole thing as one. However, after the procedure, you have to make sure that you do not starve yourself. I'm not saying go and eat weight, gain weight, but I'm saying do not starve yourself. If you starve yourself, the body is going to eat the fat right then and there. So what you have to do after the procedure is eat healthy, eat appropriately, and stay on the positive balance. Do not lose weight. Once you start to lose massive amount of weight, you're going to lose the fat that's transported to your butt. So do not let the body need to eat that fat and use it. Later on, you can lose